Since the Lewiston shootings, Mainers have been asking questions about how it all could have been prevented.
One issue a lot of people are pointing to is a perceived failure in our mental health system. Earlier today, the Maine chapter of the National Shattering Silence Coalition held a press conference in Augusta. They are calling on the state to do more to utilize its progressive treatment program. It is designed to help people with brain disorders. News Center Maine's Chloe Tebow has more about the law.
Freeport, Turner, Poland.
These are just some of the communities in Maine affected by recent acts of violence. The commonality, all of the perpetrators were struggling with schizophrenia or other brain disorders.
How many more unnecessary tragedies are we going to have in the state?
On Wednesday, members of the Maine chapter of the National Shattering Silence Coalition gathered in Augusta, speaking out about the progressive treatment program. It's a law that went into effect 13 years ago, designed to get people with brain disorders the help they need through a court order that demands they stay on their treatment plan. The problem, advocates say the PTP isn't used the way it needs to be.
It was hard to hear. It was extremely triggering.
Yesha Preventure of Poland says it was difficult for her to learn the Lewiston mass shooter's family had tried to get him mental health help before he killed 18 people. It's an experience she has lived.
My desperate attempts to get treatment from my children's father, Justin Butterfield, was either ignored or not taken seriously enough.
Nearly a year ago, Butterfield, diagnosed with schizophrenia, murdered his brother.
Why does this PTP option continuously get overlooked?
We're continuing to feel very sad and equally very frustrated.
Former Maine state legislator John Nutting is one of the original sponsors of the PTP bill. He says right now only hospitals in Maine work to get these court orders, and he has called on the Maine Department of Health and Human Services to train law enforcement officers to do so as well.
The Maine Sheriff's Association and the Maine Chiefs of Police Association, as of yesterday, are still waiting to be trained by the department in initiating a PTP order.
Advocates say they're frustrated watching similar patterns occur.
Why are people with schizophrenia or other brain illnesses taken to jail before they are given help and treatment?
And families are forever changed because they couldn't get their loved ones the help they needed. In Augusta, Chloe Tebow, News Center Maine.
News Center Maine reached out to Maine DHHS for comment, and in a statement, a spokesperson for the department said in part, quote, DHHS is deeply committed to working with law enforcement and the broader medical and behavioral health community to support individuals with complex mental health needs and to protect the safety and well-being of Maine people.